Hi, I'm Dr. Sean Allen with my Houston Surgeons. Today I'd like to talk about snoring. What causes snoring? When is snoring dangerous? How do we evaluate snoring? And when do I need to do something about it? So let's dig in. First off, snoring is caused by vibrations of structures in the nose and the throat during rapid turbulent airflow. When the nose is congested or the throat collapses, airflow speeds up through the narrow areas and creates a vacuum effect, which pulls back on the soft palate and the tongue. This rapid turbulent airflow also causes vibrations in the floppy portions of the tube that makes up the airway, particularly soft palate and the tongue base. This results in noise as these structures flutter against each other while struggling to breathe through a narrow throat. So when does someone begin to snore? Well, as described, snoring is always a sign that your airway is narrowing while you sleep. In some cases, this is caused temporarily by greater than normal relaxation of the floppy portions of the airway. For example, if you're exhausted, sleep deprived, or sedated by medications or alcohol, you might experience greater than usual relaxation of the muscles that normally would help keep your tongue and soft palate out of your airway. In other cases, though, particularly when snoring is consistent night after night, the narrowing involves rigid or non-moving portions of the nasal airways in the throat. Examples of this include a deviated septum, enlarged nasal turbinates, or even enlarged tonsils and adenoids, which tend to be less common in adults. This baseline narrowing can still be made worse intermittently by all of those other factors that cause muscles in the throat to relax as well. So is snoring a significant problem or just a nuisance? Well, there is evidence that snoring has a significant impact on the quality of your sleep, and most bed partners agree it impacts their sleep as well. However, the consistency of snoring is probably the most important factor to consider. Snoring every now and then may not require intervention, as the impact to your health is likely minimal. However, snoring every night, or most nights, suggests that some portion of your airway is not breathing properly during sleep. For many, this will progress into obstructive sleep apnea as partial or complete airway obstructions begin to last longer and disrupt sleep cycles. Sleep apnea may alter your cortisol levels, which is your body's natural steroid. It can also impact high blood pressure, alter heart rhythms, and is associated with sudden death during sleep. Significant daytime fatigue associated with sleep apnea further exacerbates problems associated with inactivity such as weight gain and diabetes control. For these reasons, you should take snoring very seriously if you're snoring consistently most or every night. So how do we evaluate snoring? Consistent snorers should have their upper airway properly evaluated by a well-trained ear, nose, and throat surgeon with expertise in treating these areas. Evaluation should involve a comprehensive examination in the ENT clinic. Often we use a scope to evaluate the nasal and throat structures and determine what might be contributing to the snoring problem. CT scans are also available in most ENT offices and can be used to further evaluate the nasal structures and also uncover any sinus problems when inflammatory changes were noted during the evaluation. Most patients are unaware when they are diagnosed with sinus disease, which can feel like nothing more than allergies much of the time. All of these results are then discussed with patients with the goal of assessing the underlying reasons that they're not breathing properly. How do I get rid of my snoring? This starts with targeting the areas in your nose or your throat contributing to the difficulties breathing. Rigid obstructions are often corrected by simple outpatient procedures such as a septoplasty, turbinate reductions, or less commonly by removal of large tonsils or adenoids, as these do tend to reduce in size in adulthood. In some cases, nasal steroid sprays like Flonase can be adequate to allow for improved breathing and less snoring. However, you should keep in mind they generally require consistent use to remain effective. Other medical treatments that might have a beneficial impact include allergy medications, allergy shots or drops, reflux therapy in the form of medications, precautions such as sleeping at an incline at night and avoiding late meals close to bedtime, and occasionally use of decongestants, which should be limited to 3 or 4 days during flare-ups such as upper respiratory infections. Most important, however, is to evaluate anyone who snores routinely for obstructive sleep apnea, particularly if they experience any other symptoms such as morning headaches and daytime tiredness. This can generally be figured out with an affordable home sleep test, lasting 1 to 2 nights, or occasionally an in-lab sleep test when other risk factors are present. When sleep apnea is diagnosed, these patients often do very well with positive airway pressure therapy or auto-titrating CPAP therapy. In some cases, however, patients can't tolerate a CPAP machine, and these patients are often candidates for other surgical interventions such as the Inspire implant. To sum things up, snoring is caused by narrowing of the upper airway, either all of the time or by problems in the anatomy that may come or go based on the degree of relaxation in the throat. Regular snoring may accompany obstructive sleep apnea and carry significant health implications, and this should be evaluated by an ENT surgeon who can help determine what treatments may work and if sleep testing is needed. Thanks for watching, and stay tuned for more informative videos about nasal, sinus, and sleep-related problems.